Marge. Par. Marge. Oh, okay. Okay. Par. Ungit lang ko lang, ang ko.
Ali malungil talyalsis ng mga beklaat. Good afternoon everyone. Waman musulang al wasamil may bangget at tial leadership meeting al alsils. Ngunit tara beklaat naman nga aking ilir tomu ora meeting rigid al tasils. Wala tomu ora alda tu sa kan malingit ra Pastor Hendrik Kwal malbol nga asmarela meeting rigid al alsil sa lubang lungu.
Ulit marbek abot talek le dolulu. Dal de mamal Dios nga rayang ada gyom ko tong rang claim ra elal itasils. Agi mo umul mereng asulem ulang sirkaw ra klis elab ngam ma usab aklem meruba kal milngit tigay mamal merelal sils. Elal sigang agi tukubet sil mo ulingit ra ong tigay garkaw tukubet elal Presidente Belaw mar mga taklela balu ang artyang agi mal mo ulingit luwase edaring garkaw bolo makalom sarang grier ade long tigay igi direkal mo otro kortir may girokuil girel matib matokol giril malbadeb bol sabi elak at gingem almaselarngum alma mga tigay gartir imo terga klitial time ulngit luwasya abud arkaw direkal bolong tigay imo makngal tangat at tial meeting raw alel mo raw lab ngalel mo bol sabi el sil niya mo o klungyo alel malubong usab aklalak lang adar belaw amo makatmok kon mo waysay elol tirak ramok tagarkaw magi mo mereng asulem el mutul mo terga klitial meeting al imam ulngit mo nga tigay ka ay gaya ong tmam algi ba mo ulngit nga kay Jesus ang iyang arlos sa walam. Amen.
Sila nga Pastor Kwal lahat time sa kalo lingit ra His Excellency President Surang Whips Jr. Walbas kita remarks rin al itasils.
Malungil 12 itasils and mora arbek laaf ngartiang ito kubet sa usus rakay raklay marugul belal los ilabangget pilong President ra Senate Hokons Paulus marugul senators ng arti ilabangget Speaker Anastasio marugul delegates Chief Justice Ngiray Galaw Justices Tiregal Artela Banggada Ral Tuta Vice President Marugol Ministers most of us itasils Tiregal mal Lungil itasils and more governors Mar speakers Marbek Adra Balul Mnos Ilo Banggeth Dire kalau kumes tawangia da members ra diplomatic corps. Kada man mereng asulir tila amne join regi dal alsils. Kita mdengel wase ablur belal al time. Ase drose ngari ase bakre ngartir ngari atribel الضغط جدا نغرتير الالسيلس الليدرشيب رابلور بيلاو اللبن تريال تيرا غومران كده جيدا الورنج سرتير اولنسال الاب الجيرا لا تغرا قوبيد اقمدنيل واسين بتوغا ام تبتوب در السوشيال ميديا نغرتيو دكتور يانون مريد راسي قبو بيل اني مورنج سرا اذر مينستري هيلد हमने मुक्तगरा मीटिंग रिगिदर लालचिल सा मस्तिर बेक अदरा अबलू लीडरशिप नगारतियां आते लेदल लोगेर आगेर मक्लो अदरा रंगुद मदबरा अबलवाद इदो मेरगरा आइसन मरा अदरा अबलू बोलो ने सिंगरा गेल गिरेदल मगल मंगत मक्ला यसब क्लीदर तियल रखतल देगल सेदरा सिंगरा कुंगिर में ओरेदिंग ओबन गेदर लालचिल्स मुंगिरेदल मोमदंगेल वासे तियांग artiang Mwarado itu urid, mwarado sebab kerja tertiarak teringia orang yang bangkit. Diregal soal ngutial teal, diregal mal, momreng asulela, a Ministry of Health dergit. Dr. Amais, Governor Roberts, tial tokor govida mlamo erurak, lobangkit. Gumral wasea awalel aureor el mera al silseng mal mlemring el continue mring la aureor adra ministra hel gumral ngasong sa aliwir di tira utagangal el aureor leng sabak klela klangara tamatal adrebelo se angara au the swir rabek el time ram maklela aureor ngadamral mring asulir la incident commander el riter udui mesel timir gidra IOC Arbekal toktan, Dr. Mogol. Kami ngara frontline omesergida de gong sel dos pe angeso. Magada gadolingit ra supporter arbekal adra balul. Supporter tire mestira smile tire kaya sel al do maske tra de kala wasa smile kami over hospital ndi motang al smile. Adang. El mortir bestira tigibel el mo do angil togol mortir. Le elien dulu aisra blur bela lo hace kadamo masim la school tal sande el muqtagra masim el school hace tongal lakla ertial mal bugo yul raqta el murtral sela blur bela kadamo de hace rangalget sel ngara oblil mera blai amin ngara blal mora school elutel mera blai ترجع غرا غروس الأبليل متيا سئل الموت المغرق كليت تيال رقت الموت المعلم بقول يورا بلو مرتوري جيجيد يقدم لون يتر أدرب له أسيقامة دعون له سكول التال ساندي إذا بستري أدر أسبيتار أتريب التايم اللي قال سالو مغو غايد يصير أدل لو بتيا رقت المال مقلول ما دخل سأدر التغور دي نجير أدر دريق المو أمدين لو أسي تيال تغور أسبق كلا terrakta malubang ngasel angar alet kidar adar belar rogoy ngira del motmak mal mongira mukser kartel al litasil segi kami rogoy low maska se angar alet tama taladar belau do maska leng betigar mudra tama target se ul do maska le murur ser angar alet kada aroy da drong le del disting 3 feet leng bertigareng awul oy mal swada ga yure gadi mel aswada al hagan diga la tirib al tamil da aroid kada dire gal mal madangil wasengar aled na mal bal imad engar aled al gargik el diga dangara maklolon dibel ya dangara maklolon dibel kada make sure ko mask ya dangara rikle malungila do mask lek madangil wase al time engar ar ngalga dal mal misisi abdir nding ngomili lama tatmlet magarak munger deglo mask maulet continue lo lur terrakta mang ngara le drogoy mogargik lol tirak laigel ologoya Ministry of Health dergid. Mang way say gid dirigal sogal way so say gida dirigal mal tangat. Leng mal betok tiriga gid el salid. Especially blura Amrigel, blura Taiwan, blura Siabal, ma blura Australia, tira Michael betok blura blada amal mol malong nga seorgid sel bodosis por ay gidel rengalela aureor. Mang dimle engawal aureor etirgal tim rablur Amrigel ra CDC agiler derbelau. Kami adim dengalia Dr. Bostrom, Dr. Thane, material other asper tirablo ol merbelau sel $0 orus etamle sera hotel ngaria first case etamle ya gumoral wasese o tisel mesel del willergid maklainga ser adron oled mabel tiger rengal igal blul mergid el samreal on waseorgid sel bornia amatar basul malu mringel mergid mang kadamre sa sule la blur Amrigel de gadilo durok ra vaccine el may mangesol bek patengas maraf disodlo aiser el alsils el wase kadidire el no se bed el ngada dur tigal salid ablur Amrigel wase agim el mol mol ngase matrigam lame ngariate alra al mut el bebir adal men ngase orgid mal mut le gele sodlo tora test kit ngari al mut el te arra gelme diriglo sisil time emloniat el confirm lo mangela ambassador at Taiwan el al tutau lo se sales kogir ngara Taiwan al mera el al mel sabadong amol taga 10,000 el test kits ma diregal ngare imol toktang gel expert in infectious diseases diregal ngari imol nurse ma imol adralab tigamel mo help para masabakra hospital gid mang akora dimo duritel wa seguida brangal tangat trigal salid di gida ko trungi la igalo sulat tinga dar adar belong aku meser gidre la sil se kada mal di waigal masugu sel sugum kada mral ngara al mol lo siga galet di sel boria auldigal kada motmak e kasabakla e se ya dos peril al time makmal merenga suli rogui no se dan arterial al sils la dadu lo bentir trigaigidel المتغو ده أدرى يقالوريور إمرال مرينا سولة دكتور يانوني أو كنا دخل سيل لو من قدر يلان دكتور كوارتي ما دكتور روبرتس ما دكتور مغول ترجع تختار لونو سيورجي ده رابك السيلس إمدور أورور هيلبر كده مرينا سولير سيلونغول سوترين ما بالتيجرين التين مرا بالوادل سيل وايجاي ده نغني أمتار بسول تيرا مسمع ده مغتقلا تقول مريجد lastly en disogal mutel di mereng asuli rogui bai ngaulan sa minister continue la discussion and di hala diktu sesel togol Amrigel en mourang asuli trigal salid. So first of all, members of the diplomatic corps, especially ambassadors Charze, I was sharing to our leadership here today that this pandemic has been a challenge for everyone for the past 2 years. But we would not be where we are today without the strong partnership that we have with the United States, with Taiwan, with Australia, and with Japan. It's through your support with everything from PPE to vaccines to doctors on the ground to help us get us through this. And I just want to, thank the team from the CDC that's here, Dr. Hancock, Dr. Bostrom, and the team from ASPR, for being here when we need you most. In fact, when you arrived, we were just at the beginning. And now we've had to tell the public that we've reached 100 cases. So you are here at the right time. And we appreciate really the continued support of the United States in these very hard times. And I know that you're here, and maybe more support will be on the way. And we really appreciate all that the United States does and continue to do for the people of Palau and helping us get through this very difficult time. You know, and I was also sharing in Palawan, of course, the great partnership that we have with the the Republic of China, Taiwan. From the beginning, I know Dr. Roberts there, from the beginning, I know there's the containers, for example, that are being set up. Unfortunately, they're not ready to run yet, but from the beginning, Taiwan sent, what was that, the infectious control box on a fishing boat to Palau. The PCR testing kits to Palau. We've been trying all different kinds of ways to get things done. And I was sharing with everyone that commitment still is strong, and it continues. And on Saturday, on the flight that is coming from Taipei, Ambassador has told me that there will be 10,000 test kits arriving on that flight. There will also be infectious disease doctor, a nurse, and a laboratory tech person to help support the hospital, because that's really what we need at this very important time. So thank you, Ambassador, for sharing that with us. And you know, our friends from Australia and Japan, thank you for all the support from the beginning of the pandemic till now. We would not be where we are without that support. So it really requires all of us to work together, and that partnership not only extends outside Palau, but it also extends inside Palau to every citizen being responsible to do their part, and that is to wear masks, to distance. And today, you know, it's good to see everyone in mask today. I know when you go around, you see people in mask. We, as citizens, need to do our responsibilities. We close the schools to stop the surge for a week, to try to contain and control the spread of the disease. We will continue to take actions, and we ask the community to listen to our ministry and their guidance as we get through this pandemic. And as Dr. Yano would say, stop listening to social media and the other experts. These are the experts here today to share with us what are the best practices and how to best move forward. So thank you. Minister, I'll give it to you.
Mr. President, lahat tayo man sa akin malingit tangakal Senator Hocons Paules, President tra Senate, ukol baskida aldada alil alita sils.
Alle kultur gerakla e boktor bolsbir tirgal kaligar ngakal meskakal wasyak ngartial ontrir. Malungil li tasil sel mergid rogui. Agumral wasyak ngartial di tamok tegergid. Kada mertial mosebedel rong street tirgal adara sidi sil tiram naragwam el mei. Bolsbel mokluar ngud el sab aklid atleta el blur belar el al sil sangare ungel. Dia ngud el sebeder rulli. Kerdi ultuir tirgai gidel الجيدة أسبير تيل لوسيس أكليد إنغسو جيد الوسام كده مغران يابلور بيلا مو للق لكلارنغو لسلب أكل ارتيال تلتال جيدة غرا السيل مكتمرين أسولي الروغوي المنوسب المي مسيل دورائل إدو بطال تغوي الجيدة نيلور ترغا جيد الأذ ملاقد الطوب دي بدو الغونغود التغوي النيادي ملاق المرال تغوي إذي على المدون اللوغيو ترغا جيد الأذ رسيدي سيل تيرا غارتيان الموصوب دي رايجل نيا جيرد المومد نيا أكتير لون يترجيد ما بدو جرا جير تير يدو جرا يجل جير نيا سوب أكليد يلا كدو جرا يجل جير اللوسيج راسين تادي ملاقر اللي عنر ليلا ولا بلور بلا البانر إلى التايم اللي كده عرا تيتوغ التايم دي كده تون يا كمال مرينا سولي الروي
Masilang President tra Senate, natamak mo tulog na tangakal Speaker of House, sabi no Anastasia, mukol baskida aldadaan.
Reklay, rugul bela susam lamdung mandiabo gumelek, aktiom kodong na butong yang kleme, lalo to song ak mo mengudul kita beklad nam sasil TV da alider semlemitra Sheriff Friday. My God, tokoy mo kusada am lamdung, man adia ka bergula botong melek la. Adigu lingit ngia sing namo time berdia ka tut kilo sing tiang mat kentil taang malumang malungir ne klungyo mortang kadwai lurol girel rurak elang maramang egida selvak lagi lurere rurak agil ngesora Taiwan ma Mrigel ma Australia ma Siawal amlang Sweden men mutrelang kada bokor gikle din diakal giredel mo awanay rausing makarador ng seurar adra blur belaw akti matraha minister elal tutak ne risiba gorra adra ng esar diakal tululoy to ay silwasing ngari atara patient kira bayra mo uang ng esar diakal serius diakal nga ospital di nga bayra mo uang itam na kogelo sing ngarsey silbo lugin en tuobo saya tetele la dor ngoseu belun motmak ti side dor ngoseu rarab mendi isolated nga ra bayra am uang ng esar kadra laway sebera la iruldat murat sel ak madngay wasi ablur bela to kablay open eta kay ngoseu elengalak tiang rak tergida rogul adar bela albang lagi koman sulang
man sulang speaker at time mo rira call laklay irmang masel ko mo alda
Palu que los dos son el presidente. Este carro en martial motlen grablor pelao. Tergal elimos con martiangal. Bado rarolela ukurulel tialkar. Magbil wariel. Di kabamaru golvela o mesra. Ara ablo. Waseng wangara ablo. Asobar ada abose paradir. Wangara dong lak rablo. Beti merte gede sola so kalon hetra madrang bogata. Bolbada maru golvela el to oikel ko kibonda swaru golvela un mala karablo.
Malungil litasil sen morga president marbek ram ngartiang tirkal mo tekle la senate marok adal kita ngar el tia leadership meeting el alswel me kung tibokum teergi del ngartiang kadumral wasing mal koteng gire del merenga sulira pitar adra Ministry of Health and Human Services. Le kadambal aswara avere de la urerir el overworked, overstressed, masong sar adrir, hindi tamalmol mal wagel lamadung maeru rakalo takaortial problem el mutrel al sils. I think we owe it to them express a sincere appreciation regal effort tir Minister Kafar. El director el suadal mo otia muil supporter give el girel ay gave ladareng ra recently ra measures el teka government el mo umroba artial el spread artial el rapt gidesel some okla school e direct lol kabaya ondible di mo kringa mask magirogul giredal ngarnging kada ko ngay luaseng gire del ngoswira government el mo stobay gel ngiam lo ulit ya raktam la sois para blur belaw meng kada mu ra travelers yang outside yang masaras ko gil may kada supporter sel waset tinggiril ang vaccine et test negative eng mas askogi. Dice lager da rablur belao kata support to segi dem lamadung recently lo aseng move tan moringa a COVID testing ra airport et mo quarantine tir kalat. Librak mo hospital let certify was the negative ru era release til mera a public al motolor gidara. Ay gang minister ka fara maldolit lo sebol sabe del kung ligay gidi ang araran rirar at. Adoreng sa latest report tergabiw in 119 cases sa COVID of lam record 394 al ada under quarantine. Mung komla a designated tial was in community spread. Lamo dia kadil ng travelers at warrior tir, lamira alsela adalang akled maklibliled para other belaw. And that concerns our toklaan. Mung Saygidel wase kami da botada ka rogu yedelu tel si angin aigel mlo ul ya covid akmer drablu mem da kaing seul beklat el gut makli saygid ko telugilar ngudel sa tial efforts moklar ngudel ngil girel awaset 95% tra other bela am la vaccinated se atara de algegrel to indirect mal giredel el upload efforts sa hospital marbiklad el vaccinate ra 95% ra adal gire del vaccinate. But the fact remains was nga 5% ra population which if you look at the numbers ang amo 1,700 tal ada represent ra 500 5% ra el diakal vaccinated. And we need to be concerned about them. Tirgel other belaw nga preconditioner tir. Nga raktir nga atituokol el partra hel dertir a direct la aswada bol klar ngud ma klar rir lo ase even though kadam lang matest hindi ko vidal bortir la il selva aksel likadab all simbal wa sa covid asbel molu tra msisi abdngir hindi sel laborar am itu tabdngir lang nga precondition raktir segida asbel lor di raktir magigidal abebir ra information na minister kafar el direct swadal moklar nguder mengsel kiren. Tirgal magkakarel ngal karel al direct diakal dirgakal vaccinated a direct I know I speak for the parents direct di tire prohibit taranal girum diakal por hospital it doesn't take the public health notice and mortir we need to really get out the facts my information and mortir ngal nsi il moklaran dire kada upload sel 1 week mo diaka school kada trial share ay gagid information el marbikladong moklaran dir madalu to resume el self aklaran dir parents martukla ngar alera arbeklade agi nga direct ng artiang join na arbikladam sel lokodong wase dia kadil hospital amo ngar alel tiang kidroguil from the Rubkul Belao, morar senators, delegates, governors, speakers, magidal adrablu. Kada magarang may galungil, el practice, el maral mo ngarablu, marana mo understand. Lisegi de atara, adesar el almo titogla, de kadil tora school, at tora kameldil, at tora ngasa, at tora reunions, at tora gidilon dibla. And said, swadal mal mo bekladal madanglia tamatang aledal wasin dia kada help spread out the tial mura community even more. Sel advisor mami kafar rubul belao akmal diolgit wasi ay gade kadil ngarara arang mam ngararan dir bekladal ko ramadaktan malkoy. Ako ting tolalolgit rigid roguy. Luase when it comes to the issue health ma economy edungwa heldra tamatal adal mo arbabra at tora geizay. And maybe help explain and mortira amral berredel ma at transparency ma seriousness ertial rakt. Makreo saklangan at tal adal gidrogwel ako gel kasi ka millions of dollars sa sabi store raklangan 1, 2, 3 entangkad hindi ka the borsis bersegid. But I think ay gigid ang aran dirar adal Ilgire da kayo ngasul beklade sumok lang mo clear. Ang reality ang talamal la ekonomi ra tora tourism di el sela blur belao actually bkadamla salba akla. Le construction economy marara al sela blu, a retail industries marara al sela blu, a government tamle wila program ringil make sure hindi kar adal lay offer tir. Ma private sector man direct mirala a business tir loya ka a domestic demand. Mutiyay gidra la ka mal mabul other belaw mel mutrel al sils. All because in the mlaktial community spread. Kadabay rameng sa batok masang mal successful result rin. Kamaldi you name it. Ngwadim la reflective ra COVID hindi without the root tra al sel ablua pa mal mleklol. Lengmleke ngari confidence sa ade selba akla. A program na government to make sure hindi ka adal mo di ka lurior amlewil. A reality was endim legal shobayar ar adang od al blue el ngarbela ya suffer. Hotel industries, magil tourism related industrial low spare ar adang od al blue ay gigid amrang yam no suffer. Iyarbek adar bela amral dim lang ya ungila antinyol ngari ya ungil urerir maungil karangir maungil lo mangitel awdo maul mo lesel ba akla etya nga point for the government berang asulela executive legislative will continue to provide the segi that support them lora domestic sector di ela ul magadam akldible besaw dengi ay gagidal measures ang self-level community spread imlamo gida the limit at core school limit at core on dibble limit at core freedom of movement. Limit even agil number as kogil mong mosab el merbela I hope and continue ling adirek amodekal sorry fly el merbela uling al ngari community spread. And then ar adadal los pe a medical referral adirek mo suffer sel po lakas kogil mi. Minister Kafara at taramat sadan mo duli lingararan di arbulu hindi akal bageul sbiilo keringi awaseng amlam mo time direct the test tirigal sbe mera hospital ma armom karyor mo kodal to make sure etial covid adia kalingia contributing factor mo tirigal adal mo sbe rebre adal mo re-darak tiril mo serious at tamal. That's how serious our other ang umdas will giril tiyagid. So we need assurance, we need confidence wase aurere da transparent emralo otia asya singer tial impact ra COVID. Finally, sel sorira rubugul belal moduli a support ra hospital reng the sooner kadung tial problem ra COVID under control ang mo sabi elaw guru le direct mo pay attention al morar adal direct el ngariya serious retiren din dia kal COVID. And I know la dulia Dr. Cuarte, Dr. Roberts sa ikal na mo break wase hospital ada dito mkarar COVID. Direct mal beto kar ngariya serious retir los pe emergency direct el full medical attention malakat al COVID boluul take away attention from them. Ma public health may preventive programs. But the bottom line el southern ruler al swelwa say whatever it is ludur adra hospital let's go home after this meeting. Idamral ngul mengar aledal share correct appropriate emral information madirect what we need to do as a community. Itang aswira ka farmer at hospital gut mukli malakal dudul asit yang alila hospital malubeng kantiltang. It takes a community to really make sure that tial rakta will go away. Ay gagida asesel mo sa mong yung malmasaw tial tial. Thank you.
Mansulang matang buko. Agi direktal malmering asulem rakuk sera Era bomere kal president regel guk effort sel gida di lakal gut mokla. Ra walel tial pandemi kan mon mutra guk kal change administration. Magi direct kal man merenga sulim sel support. Sel domesar agenda gite sekal mo maskida akora updates ra guk to era cases. Kagi da Dr. Makol ngartiang niya Director Hospital ma Clinical Services Direkal sa mamal terung kuk mau ay sa igel bebir telet-tele lauriol potong otmok magiblam mamuul mga otmok ra ospital el malas mal mga sadal ra predel tegi del rakto kita madang buk lo o quote sa el bebir gagi del ur eli Nadibok pas kita update ra kuk di sila guys el monmut ra taklog el alsils taklog ra itasils el ay di sila guys el lamadang ra el alsils el monmut ra taklog el al 12 ba 23 guys nga niya bebil nga ra lamadang ra private clinic rest 12 nga ra mildang ra klol hospital sa lomes ringi nga ra 123 active cases el at time Tirka ka adal mo New Ying ang COVID ul. Tirka 19 namla recovered. So adal makatakilo sa igel case ang matang agirel true club sale wal til isolate maluba kada isolate til true club sale. Sel test kita mo sa edel mula set na mo mregar sel kalsela infection til. Sel time tiram le buku yul. Iwaigel dilo nga madrang bukod. Tangariya at least at 394 close contacts. Masel domes ra total lour cases ra blur belaw since ra August 2021 emlamo 142. Direct kalswada low ice lo se omasin draigal active cases dirgal 123 case. Adir ka malmol mal suko mga niya symptoms tirang mild. Masin tira bay dimla kalol aswal waset infected emle close contact me test bay mo madangin waset infected direct close to teleleng segi da direct rengile laurele de roguy sabela adal dia kalol aswal wasen smer emrael oy walin martaraat segi da direct ul mo waset tugtakang lo mask roguy tolas maldi aroid Tongoroy tergidra adat smere at sukum ka smere ila ka mo mais. Direct sa dalaw ay silwase ay gel kalde alim lamok kalde quarantine kuming isolation facility amla mo masekat. El altay manganiar adal dol durok kortil mora kablirir lolingit tertil sa tadi isolate trablirir. Ma adal me madang al positive ra either ang klol hospital malubang kal private clinic ang ani amal bring it tokol mortil wase komormei isolate el girel 10 days se mangira to era other hospital la modia kal sa edel takara idisira raat regal isolation facility o sisilta met tirigel close contacts el madang te direkel ngaringia to el mortil wase komormei quarantine mangira test damadingel waseng di maral mo cloak tiarak dia ko dumulak Waigel dilong tirigat toktang malimis el buku yuyul. Malimis el buku yuyul may waigel tilong sa ela adal dia kalul aswar ela infected. Tokuni kidel pelur belaul klora o kail basenta o til basenta mlamrus. Seungil toko inding direkel dia kal giredel umakpuyot at tiarak. Direkel warinyar adal mon yuying. Giredel Makataklisel wasem moriar adan mon yuing el anganiar adan mo madat tel gobi. Egire kal duli sel minister ahedel sukumung dub endia kal gire dalo. Magi morigel kurbabel sa mamal guk. Sa okrat teletal bla sisber alsen ding sa gidi. Kadam narmeng sa tirigal toktang lo se oy nganiar adan amon yuing e direct kal nganiat te elir adan mo madara gobi. Mang dakal sada lo makpuyot tatoy le domesra adra bulun ngora talgib al awanar sel al sel iosil gi mangara al sel malgora malgora kya obrao da sel situation nga al sel mong kadaman mo malo mesra situation o mesra capacity ra hospital tirgagi tirgal sa lidel semmong ra tial tokoil lobang kama malo mesra igal facility tirgi ma artoktang mar nurse e ol nga sergi del momalar tirgagi dil tira man mo critical al sugo mo moringi ingora di sa del makatakli sa igi del wase kama magimal direct take this very seriously e direct kalbagi kar adamam sugo matamo smer even malakal sal mo kora hidot smer et mo dakal si ilo mesra smer sige da direct challenge kamam mang testing adir gamalmol hindi gimla more Russian than more tirgel symptomatic. Unfortunately, hindi ka kadangay test kits. Sel adel el may, kita mo sabi adel open testing in mar adrabalu. So kita clo limitation, nakadamalo ngitra kaloreng at matingil waset tabagik lematak. Langan yar di mo ongir temlas lamo soril murtel men test. O dadil mutlo ngitra adal wase practice preventive measures edo takang al amila yagid el test kits. Misal me yagid mo sa edel el test. O sisilta magi mamrur sel triage site. Brenga sulela Governor Dr. Roberts sa el kongir kama may hospital at talgiber sel facility ngira tar hospital esel tabakara kli sa igid ya rogul adal kora ongir tamar kora o symptoms el mo positive amor sa igid ya toktang amor se assess ra adal wasenggang di hospital Tylenol mormei adang girel mo malayakar e direct kalgar mamaral meng ani akal dolap yang ani gel maral mel sa edal hospital di kora hospital sa igid mo mga sadar sa igid TLL adal positive el ko si subira emergency room malubong ko si subira tara clinic se Dr. Makol al adi etsela klugo kung nyaw sal mamayo de kita opener sa igid o si silta magi mo opener a hotline el gukti toktang maluban nurse amen ringi mansung niya adrabulul simbayal girela symptoms ringi asap elo makotong yang aring gigidil medical provider lon nga sewringi na dingwa say magidirect mo announce sel kim establish ringi yabay kulitra Dr. Makol maluguk kolbol ilsa daigel baby ra measures sa giba mga tmok ra klol hospital including sa hotel awa clinic ma abot ka sabi edel mo kutmok ra al kireltya.
So lang ministerio malungil suelo kay gidel ligang at gidel change sa bebira activities ra augurul ma kadamda urang asuliar bekla adal ikal mergole rural prepare el gidel tiang kita madela sa visiting hours sa hospital bled limit ringil mo 1 hour di sel kapasingin di of course tiabelaw mar visit ra 2 tol mo kapasingin el angay siya mo completely india ka visitors el mira hospital ay gal next 2 weeks mal ko na mumtar basulen di ngari adala sa uldurok langrang ngari adal mo sige del time sel between 6 to 7 en so el ma uldurok level moment that india ka da utangal mal dia ka da bong ngari gel baby ra clinical gire del mostop ay gel do asendia kal emergency surgery ay gel kaya bod stop di gel emergency bot kay kaya morgi ay gel clinic ra a NCD ay kaya bodo lukla el mora chel CH ngara bitara koror mairay gigita morgi ay gel clinic giling mendia kalbel ber hospital yang kita langar niya adel bol expose al morgi gigita bebi raigel changes bo the may grigi a bebi raigel clinic rarwa aigang amo to stop surgery ma medical ay amo to stop le gigid hotline lo ko minister kama mal mo girela adal ngarngi ay gibom rotate tra adama mal ngarngi mong mo kal sebe dal continue baby regal clinic ay ga mol telgib mo ngara erul sunday mo budul edel sunday sel tokora haisya mandiregal mo trouble di mo emergency awa omlat elwing lagi mo stop mo dia ka dolat ngler di mo igel emergency tokora dental diregal kamama diregal mal urang asura community lagi uro lo bentrir sel funeral home kita diregal do uro lo bentrir temetengel masing 1 hour sel do pa adal mong 1 hour tanga segi de mo merek te diregal mal lingi tergi lo se kado mas kadabo el limit el dimo 4 and 5 al ada mora segi sel do ba targi del mong mama dir kemi itu sel tele la pharmacy mo sabe el refill la cruz dia kadang hospital do la gel cara y mo sigue vacío maybe en seguir bitar a corol mo subir refill a carrir diregal seguir lo logor ngi ministerio hace mo sabe el mo do ratok tangar gitu tigel NCD el cansal tertil gire lagi del grupo mungoy segi digal plan sergid di dekat mokre lang SL uk change rak lugu kolmong mung dia kal ligay da sengi ka morgol uk teletele ko do mes evaluator tial toy ay atigal adamama sera ongem lurol marma khusus jadi morme rangana midnight ay gel testing rirur ewal dar traba every day nanya one time te test 300 almost well tirga uspe arrest el direct mong ngayar baby mlamos mer mong segi daw ul mo wala sa kabisit el mer hospital uk mestiya tama arawor metabreg es i rotate tregagi del urel melibek sel emergency room obla me sa change ngi mlatto batagel ngal al sabla ngal outside mela kad me rik le taskenger gi raw era do sis sel mut el moria change el mar al sel el brar gi de mandia kad ngara de expose ra ya rogul newing tigel mo newing a get tested emot mo I think sira 2 days ago ngaria adlul ba maasar gil mail mora mail engya test el positive yam asar ngia soara arol meng test eta continue test ngi en hospital ng lam el maluel dir ke negative el marma elang magata mal urang asular bekla adal mal koram lamu exercise ay gidel hand washing may gidel masking mama ngal tangat el tigidel uk expert ngartiam elagi nasta talo bentrir so I get plans go elanga I get el change rak lu kolmo so we'll evaluate each day mega changes koman sulang
Doktang, perhaps at this time Dr. Thane, Dr. B able to introduce yourselves again. I know it's a bit repetitious, but and then perhaps talk about some of the work that we've been doing over the past couple of days.
Okay. Thank you, Minister Gafar. And want to recognize, thank you, President of the Senate, Speaker of the House, senators, legislators, governors, traditional leaders, ministers, and all of Palau. Sorry, last time I was here, same thing. I always pull the mic away. I apologize. Really want to thank you folks for the opportunity to be here. I know it's an anxious time, but really for all 4 of us here, it's an honor to be able to be here with the people of Palau during this historic time, right? And we're here with you. I want to introduce our team. This is Dr. Brostrom, who many of you know from his many years of work in the Pacific, as well as his previous visits to Palau to help with immunization, as well as much TB work here for the islands. I want to introduce Commander Kazu Okumura. He's our regional rec, our coordinator of really being able, he's the guy that is able to bring in a lot of those supplies and needs that the hospital and the overall response requires. And so he's been here working with the ministry to really look at gaps and help fill those gaps. And then on the end, we have Commander Nick Munoz. He also has expertise in identifying hospital and preparedness needs, but he also has extra expertise as an emergency room nurse and nurse practitioner, and he's using those skills and experiences from working in California and dealing with large COVID outbreaks in California and other places in the West Coast to help the Palau Hospital better maximize its ability to manage COVID-19 patients. I know that we're from outside, and certainly Palau has received support, but you know, really the most amazing thing has been Palau's ability to leverage your expertise and your own local assets to really create a response to the pandemic that is unique and has been a model across the world. I think much of that hinges on your ability to work together, work as a community, and really implement responses that are tailored for Palau. And this work has paid off. All the work that you've done since January of 2020, especially the vaccinations, even though this is a new threat, this Omicron, it has saved hundreds of Palauan lives, just the work that you've done. Of course, we know that there's still opportunity as we move forward to do a few more things, and that's why we're here, and we're working with the ministry to really do that extra amount to be able to further protect the community of Palau. As folks know, this Omicron it's a different virus, right? It's extremely contagious. The vaccines that protected you against all the other variants protected you from getting infected, Omicron can infect you if you're vaccinated. But the vaccines still help prevent you from having serious disease. And so that's why we're really encouraging people, if you're not vaccinated, get vaccinated. If you haven't been boosted, the boosting has really showed to help, that it's excellent at helping make, if you get infected with Omicron, that you only have mild disease. And we don't want people to go to the hospital. We don't want people to have severe illness. We want to limit deaths in Palau, of course. So that boosting is really important. The other thing about this virus is it's so contagious is that it can move so fast. It has outraced all of the isolation programs in the US, all of the containment programs. If you look at those charts that show the infection rates, and we thought the Delta waves were high, Omicron is just straight up. So unfortunately, it may seem like, oh, they didn't do enough isolation or quarantine, or they didn't track the patients enough. But throughout the world, this virus is just so infectious is that it really makes, it just blows by all those systems. And so I think that's something to keep in mind as we go through. If it's very easy to get infected, it's easy to infect others. Even if you're vaccinated, you can get infected. So really be careful of yourself, be careful of that you may, even if you don't have symptoms, you can infect someone. And I think out of that is an importance to really have compassion for folks that may have been infected. It's such a speedy virus. It's really hard to stop the infections. So what can you do? What can people do? One is, get vaccinated, get the booster like I mentioned. 2, wear a mask like everyone is here. That really helps limit the transmission of it. And then 3, I think, listen for the updates from the Ministry of Health and Human Services. Updates will be coming up. And as I mentioned, this virus is really fast. And in order to be able to meet the challenges of this virus, the response is going to have to be agile and adapt. And it's going to change, maybe on a day-to-day basis. So that's where I think really listening to the Ministry of Health and expect that sometimes policies are going to change, maybe even within 24 hours, as we have to adapt to this virus. This makes Delta variant look super slow and easy like a glacier. This virus moves extremely fast, and that's why need to keep in touch and be aware of what's going on with the Ministry of Health. And then finally, I think the last thing is, I really encourage, like I mentioned, this is an anxious time. I recognize that. We're here to help and support. And I really think that this is a time that all of Palau can continue to be a model across the globe of what can happen when people work together. This virus has divided communities all over the world and really utilized that division to spread. And for here, for Palau to continue that respect that you folks have showed to each other, the compassion and understanding as you move forward and do what everyone needs to do to fight this virus together, I think is going to be key over the next few weeks. Sorry, that was maybe you wanted some more specifics about other things that we're doing, but certainly over the next week while we're here, we will be working very closely with the Ministry of Health, helping to refine those systems to slow transmission and ensure appropriate response. Dr. B.
Thank you. And as Dr. Hancock mentioned, it is very humbling to sit here in front of the leadership in Palau. We are grateful for the opportunity to work side by side with your preparedness committees, with your physicians. We just came just now from a meeting with all of the doctors. And my impression is this, that there's been a change from when I met with them in March with the vaccination effort. And my impression is that we see the doctors who are very determined, ready, have already started with action, already beginning to prepare the hospital to handle cases when they come to the hospital safely. I think Palau is prepared. I think it's very obvious to all of us that, as Dr. Hancock mentioned, the work that's been going on has prepared Palau. I did want to also add that the partners in the region are aware of what's happening here in Palau, and many are reaching out already. Support coming with tests from YAP, support coming with testing from American Samoa, equipment from CNMI through Guam already being sent here for your use. We mentioned already, I guess, the assistance coming from Taiwan, and then the Pacific Island Health Officers Association already in action to help Palau in any way necessary. So Dr. Hancock, of course, went over already. Thanks for your inspiring words, Dr. Hancock, and that's all I really need to say. We'll be ready for questions. But I guess you've done introductions, so we'll hand it back. Thank you.
Thank you, Dr. Thain and Dr. B. Tisokalaw ay sa kapsangay, ay obtetrin mara talk show. Direct kalgukte alar adrabalul, lomakotongal mara call in live, also mga niya questions certir. Magsupes ang kora, lagi rin kalukura uliyo tatikingin di akumdas ang pera misal mara talk show, also mbay nga niya specific el gera adrabalul, sabi el lomakotongal loker. Yakuk wate alm sa nga Senator Quartey ma Governor malkukan nga sorry mo.
Sulay Ministerio Malungilitasin san mora arawila. Manuel wase no Quartey nakora malso garngut. Saka kuma maskara. Tungkol bitara ka farm hindi selberedela ato Mr. President nakmer W belaw ikamam el adrahel albebirata men dikamam el mo umdas el wasegle blala kal kimlu lawreram kleblel sabam el makaram kleblel sabam el advisor society a little bit better. Akti duli sa gidileng affected gidil rogui. Ti for some reason ang affected mamar adrahel 10 times more. Like you feel very responsible for it. Pero ng alam, di kasi aswam al-OIT. Akti moblak takla. Akil mutul modulya tol matatal di kulokongil wase asain sa ngaringi. Ako lingit wase boto pa attention on mora science. Ele science mel sayidi a post el domes ni measure ayer rogul policy decisions el dorul el gire tayid el particular ract. Kada ngaltatele Omicron gidem na mokrok rabiled el vaccinated mangway release el bilen mo kapakla aparedel mergid. Hindi Dr. Tigal expert tongil was sila by the end of the year el mutul mkorokla imora variant el tangal mutul mo hidort ya mangire del mo korgik like el policy mangire del mo kaudingir rokoy makalmutul duli tal tol mo ministera health del wase ngire mel continue adapt a preventive policy tial langaringi a reactive. This is not the way tiadim lakadongi lerni tiam lesebe del control lerni البيس را ساينس امكي قوجيد المويه غلق من مدور السلاب لولاد من دابلتو مقتولي سيجيد النكسل فاريانت تابل سيريوس ان ديغا كاباسيتي جيد لورغدي مقتولي تيجي توي ركلاي ما بريزيدنت سينات ما سبيكر ما غفرنورز ما بريزيدنت ريبابليك ار ادلو ار هيلدر بلا مال مقصاي Ingal virus, calculator sa el 394, there are other potentially tamra sila community lang ang rakmed 900, yung na expose. Ar other ahel da tumogir elger. Makmal understand ra minister, understand ra director mogol, understand da galol ko trigal maral elimos kala. Hindi gira mo protect ar other ahel, the lomes ilwas ka magrang stagger. Aigel scheduler tir mendakal di tiro ko musmer. Mengdir kal ngara private sector trial stagger atele lagi moyor lakal melguk lemgim daigel support el mora community at large. Maktiduli sa gide presidente olingit elwase atogora sain sa dial criticism. At ora sain sa fact, gire del mo omes. Makoting, akulgan niya sila tara, mga tala sa nga, sumang way sa gida nga mga test. At sumar ata na ministry kuman na mo, o dahil sa irmul, nga mga test. Kadamdangil wasang artyang. Makumda sa gire tara tayo, mga di mo asumil wasar at selbol, sel, yung tiyay gidi. Nandiya ka ngot, el tretel, di mo mesra klinik, nga al sila blurpelar il altay. Aong erong, Eduluto mo meso sel palasira entil wagilo ko madra mabugod. Mlamo di kal make sense asung Omicron na 3 days sa incubation period. Kita test ra adult 78 hours ra 72 hours sa wala sa skoki. Di kal make sense. Makti duli sa gidle di el sela telaklob sa president. Yung mlamo ra mo masker ro kuy. Mo bel mo close sa skulet. Maburden ra COVID aklmutel duli. Aburden na COVID al tangguk ora di treter. Hindi kal segid aburden. Aburden ringi of the sweeter other belaw. Mar adal kal sal sabil mara gurur elang. Tirigelo re kada yer raktir ngari atte din mosmer. Le kada mal masangara ayga. Ngara school na mo de asin masku. Ayge aburden tel COVID ngari. Makagril wasemlamay kadang tengah kada vaccinated ang bod aungi bod eokli lang ataw tadi memrael actual ngit lo se la momda societe ya endri le next variant as el mutul mohidor ya agel gungoy bel babere la time makwat ya te al ora masuliw edige gida pokto kom sulang
ya ngilo to song presidente para claim tigan luwag ma other rogui balik time dalbang ringin hindi Gida ko tanga tabalu. Direto di mereka sudah bakti Joshua arokui dengan jadi dengan dia arod, jadi harak tengah ni. Ni dia keluar tu dengan mari kerja kesal bak. Respect kita time mereka sudah arad. You know, we have to thank you, Dane, Dr. B, Asper team. Thank you for taking the time to be with us at this time. Seems that every time we have trouble, you show up. So maybe next time you show up when times are better, we go fishing instead of sitting here and talking about something bad. Anyway, thank you for being here. Maraming asulyarada Ministry of Health, Ministry of Human and Health Services. You know, President, it's been 2 years. If we look at it, in 2 years, other hospital, we were in a preventive mode, prevention for the past 2 years, and it kept us safe. Indeed, we had to progress, and we are where we are today. So we went from prevention, now we're in a damage control mode. What do we need to do? We need to do everything we did during the preventive mode, but do it even more. You know, again, that kept us safe from day one. We need to do that even more now. We're 95% vaccinated. We still have 5%. We need to vaccinate everybody. Vaccinate. Boost everybody. The Segida science, Senator Quartey, that we know works. The Segida, Msawakrigid. Mandiakagid, Madak, Yadakain, Sew, encourage everybody to vaccinate. And mask. But now, we have to mask. It's the first time in Messiah other video mask. You know, people are getting the message. Masugum gidin ngara a leadership position amruringi and other ablua o giuled. So we need to give preventive measures needs to be even more enforced. Vaccinate, we mask. Yatiagid ontik. Seguida, matangay, ngasong sa resources, ngasong sa rogoy, gagida, director mogol, we have to prioritize, we have to limit certain things. Hindi, akmalyoling it. We try to maximize services, hindi, I get more pressing common problems every day, gida mga rather than every week. Most people are dying from NCD. It's a side effect. It's a collateral damage from the attention we're paying to COVID. Kadangat-ngat hindi ka other mother COVID, kadamrulaw relet, di lang kadobes was a problem of NCD is with us every day. And one other missed appointment ringing, Modia Kakarul, about say that's a casualty from COVID. You may not die from COVID directly, but it's COVID related. I get everyday clinics close to them. Example, in Al-Karayul daw, Giroy Drarokoy. Several masong sa resources sabi bilat time bet the men the anurs yung umaray na. Ngayon din lang anurs in 1 week. Radio the last 2 weekends hindi anurs. Lang mga songs sa resources. Hindi those kind of things kung das yung dire mo tong man mo ada dul mo ngil wasi the prioritize ang arang itiagi da yelo go Dr. Quartey we have to kung das yung Minister Gafar a testing burden ng our hospital. But it doesn't have to be. So, you know, I think we need to plan and do more testing sites. Of course, the clinics on myself. Ninsa edun really testing site pelingin labru mungir Paulao north south and prevent people from coming to the hospital. There are like testing sites all over the place. That's what's happening at Taiwan, other places, and that's how they manage. We need to do more testing away from the hospital. Agila dondas we wasa kada magarang ugut mok la dondas we spread the burden yang matayibet kita rokoi hindi gigi tilung kada ngat kada atsela amringal daw lang hindi kada kasal baak migilan mo klor mo de ba imot toy kita local president ngani seu mga kita angar leadership position kada mga lakra adablu mo klor ndir like Dr. Corte said, we will get through this. Komam saun.
Pandusulang Governor Dr. Roberts. Wala do para te alalo okerager idiklu tel ngale rabekla adlo se podo lokor tirigel kalorus amrusa malmolma amrusa malmolma lurel alsils misel bekel got lurior ma ongete lurior ma ongeyim lurior ngaringi sel Pfizer mora eyimar clean morbab first dose ma second dose esel ku kongeru lurior madurstay yang maternal booster ar adults ngania orus malsugum ngania adal modern tril giril mamrus malubong ngania ngal giril sabiin mamrus edog takangal kaing seo lori mertila se pomorus emal lungil luldas we governor sa igid del mo testing ra pagaro salvasyo amal di dongi langi igal test kits kama mga tmok ra plan el momru til igidil o sa era adal test adi swadal lolingit ringin sa igidil dilya senator quartel o sing atat ya di mre hindi katolingit ra adal o se poto karigik to karigit am lamrus matanda katol aswal o se kada infected iba yung mo ra bleed ngarinya uodl talad malubong maligid targid ngarinya rektel isigi dinga mo uula adal mer hospital te elela adal me giren men yuing kadamal nga tangat telemral ko rat telgibel kabakak latyang rakuk tokoy ra sa redra patingid nding dakal kabakak tokoy dakal biyot tokoy madakal biyot talrak kadamal mutul ngit tabek ada se di bodo kargik la sel domesra plan ra NEC yung wal sa edal di malmon marokuil al time di direkel tokar adal madakta malsugum ko katim el mora ko ra klol londi ela ko pong sugum katim lo mais la kamadakta ela mo mais to kunit sugum ko koras me el alla ka testing katokora bagi kle madakta hindi osisita ma domesra bebira adra bulung ko ra wala kang ram makada malolingit ra bekla adal se boda ta ko rokuy ito takangal kaukledam may takay ngasew ang giret tiyal tokoy kumdasin ana mo sa edel kuk penate alra adal sorry ra lo geraget Senator
Sula Minister Nalungil Swelbel Marbeklat. Good afternoon to Dr. Hancock and Dr. Berstrom and the rest of the of Island team. Thank you for coming to Palau and assist our public health people to help with this situation. Minister, question nga ka, ngora tokol question ding wal ko di connected. Al dilungil di ko adik muro ko yung idergaw malbit tigal al adra CDC will go responding. Ako te en sa dal momdingek na tial COVID-19 may kagita la karusel variant ringing ay gang sabel mara sabel mo multiple times la ada contract ringing al sugo mong say every time la contracta tayo del COVID-19 aniya kora impact ringil morsel effectiveness tial antibodies ngara batingem malubeng o ito atur malubang katalgib el help els misiil rula immune system regal wabol sabel misiil lol da alakat yang ang erul gariga nakmlasing el al domesringil welcome namonia community spread given the fact that تأكيد الأوميكرون عمل بغيو إذا سأد الكلاسين وال لا تلقيب لنغلق كنترول رجيد السبئة المرئة الستوبرين من كده تلو مصر سيل لو أورل ديمرال مقلو given the fact that nasing kailangan sa sila capacity ra Ministry of Health ang sa edel kumlasetya will be with us for some time. Sa igid fact that nasing mo bangged makatektal time, it's gonna definitely change ra a dynamic ra society rigid, especially تلت هذا بيلاو رايقال شو عن رجيد المقلديب المأسان بتوقع جيد القرى بارت رأي إيفنت المقلديب البكلاد ما ذو مرقنا سيجيد أمو willing contribute المورا أقلول spreader تيجيد الباكسين I guess a point to trial raising أقنا saying given that situation in amlamo tamil gukire del lo mesra tletale kada lis akra adra blul mo o not only overcomer segi del daktir mal anxiety til girel terrakt kadirek lo lis akra til mo adapt el mortiagi del pesel kada dula sem new normal for the plant people. Seguida kung dasan cloud tutelel as leadership gira de nomesrik na sing al sugum tiang ado mesringi from the perspective ra held officials ado mesringi mo makatek tal tam ngar al sel belaw mo makatek tal direk mo ngani ate alla yegi del guk PS variant al dub yang mo o guk mo bes el challenge el bod al bangal en agirad el direct el jadid dolis akra adra igay del tora au mask ma mo mala vaccine gar direct el lo aisar adak na set yang ama partra anormal mo ves normal partra life forgid mong ama agirad ko kachasta tele dan maragel bekel tol dorura bega igal imamade radamrura bekel silsa tora ama sang ma atokora mara school atokora mara urior ay gigide ministerio kora es el cuestión lo gadim nesual loger es el lubong la ngania del lo texel milk na seka mogel na sing melal sum maaringitial situation laspet ya raktra blur belaw ya ngania ko kora plan gid el platakat maklil girela al sugum moria adal mosmer tiarakta enguk magara tretele labo da tehender gigid el adal mosmer kada mo isolate ngira hospital ngania ko kora tugubet el tretele kada treat ngel adal el mal mosmer el direk el sabel labora dal atet la kamal di lagi ako dasang adirek el baby raplan ng awda swira adal sorry mo mringat nasing kabalment rigi ng ngup ngaral da swel girela ay igidel situation sila minister
manusulang senator erak mo te almastri tirgal sembong rarak te girela gel kotel tablol karim edik poreng gelong edey akti blakatak lo ay sa setiam la pre travel mangmoringi ar adal mon yuing el amoringa ko dal es el plan el domes ringi lultuy ringi ap le plan ra egel variant traway el mlet talgibel lopting el ending talgibel soro tia mali misra buguyu magumdas direct el ul makadokora amalil ta kakaroos el strategies ra igal kakaroos el phases el plan o omes lo sengra sa edukut mokre el time emeral klo al kot mapli masel tokoera school le close adia kal ngara phase 2 ngara phase 3 hindi kitam lo mesalo sa dakat makli sayang la direct kal sabael ngosugi del marobra predeltial rakt mang malmaring leng say gidi wal dil blel al sala edel sunday emoringin kay gidel bes el variant temla a pre-drabl other rogir emla soy sa bebelaw ngira del bla takir say gidi ay gal plan adrul ndi bebira tay ngira del buk moltaw ta kagaro sa teletelel el mo atter situation dangar alsel mang akumda sa say gidi al pornya kodal ngira del adi omesra tetelela akamaldi lo seng mang wangrang may gigid el dongot mokre at time ay gigid akot el bodor at time so aplit kada marus e o mask e malbal moroy dirgid rarat omset el lakamumais e moroy dirgara adal smen ngari akar sa edlom kara adal niya amosmere toktang amesal waseng la uspe ra karal lon nga seurngi hindi namodyak sa edlom dasul wase nga kamodyak ngutyang. It's that contagious. Hindi sa paedel taligibal malas mal soror sa igid el spread. E maral way say new normal at igid. El altirgal tewal adra CDC ma aspera o bangyadal ngarter ilang o sisilta manguk nga niya timara Army Corps of Engineers matara toktang lgiguk kum moriolo bantrilo mesra hospital igid el waseng. Makaranga abodorura ba es ngraigel gidel del gargik el gidel ulang problem hospital elam mang seguida direct el challenge kama el alrak makarado takawar tiyagid el rak del covid o sisil time kada malmol maigel kuk maklo tu telel luria rabek el silsil gidel del gutmok la kama ulay gagid lo ulgoy tirgal terul toktang argid NCD ma yel gakaros el tokol niya dimla ulse ergid ang ramo mang aktingun mo sa igid kulingit ra tirgal terul toktang bro answer. So Dr. Thain and Dr. B, the senator is asking, with this variant, what is the reinfection possibility of being reinfected and maybe talk about immunity, something like that, regarding this COVID Omicron variant. Sorry.
And sorry, just to clarify, the question is chance of being reinfected after having Omicron, and then impact to the community, or just a...
Well, basically, my question was if a person gets reinfected, does it affect the effectiveness of the vaccine or the antibody that's in the person's ability to fight the virus?
Okay, yeah, great question. So if you have been vaccinated, your body has some ability to fight this virus. The antibodies, that's one arm of your immune system, they can slow down this virus. If you've been boosted, then your antibodies are even better at preventing and slowing down this virus. After you're vaccinated and you're infected, that vaccine is going to help reduce the chance that you have severe disease, that virus is able to really make you sick and make you go to the hospital. So it's so important to get boosted. If you make it through that, so you've had the vaccine and the infection, you're going to have good immunity for the next few months. Now, this is a new variant. We're not sure how long that immunity will last, but if you recover from it, you're going to have even stronger immunity. But that vaccine, it's not that the infection of the virus is going to reduce the effectiveness of the vaccine. It's actually that vaccine is going to reduce the ability of that virus to really cause a bad illness in you. And so that's why we've been encouraging folks, that booster that we're finding, that the booster, especially with Moderna or Pfizer booster, if you get that extra booster, it really helps bring up your body's ability to fight Omicron and really help reduce that chance of severe illness. So I want to encourage the community to do that. You want to add something?
Yeah, just one last category. Thank you, Dr. Hancock. And that was if for people that got the Janssen vaccine. Last time when we were here with the team, we went up to Kaingal and we gave the Janssen, better for the outer islands because one dose, right? Those people really need to be boosted. Because it's Omicron, there isn't enough protection from just one dose of Janssen, and they need to get the booster. And the public health has the boosters, and tomorrow will be their first booster, and I believe the hours are 9 to 3? 3 to 6 in the evening for boosters. Thank you. Sorry for that. So it's from 3 to 6 for boosters. On Thursday will also be open for boosters, open pods. And then depending on how busy that is, additional clinics will be added, possibly even Friday or Saturday. So they're working hard to make sure the community has access to these boosters, which are really important to protect yourself from Omicron.
The other part of the question, Dr. Hancock, was if you get Omicron, can you get reinfected by Omicron?
Yeah, that's a good question, and sorry I missed that. We don't know yet, right? So we've seen with the original variant, it was very hard to get reinfected. But as this virus mutates, it's likely that if you get Omicron, you're going to have good immunity to Omicron for a long time. But we don't know what's down the road, right? And so that's why I think it's that being prepared. We know that the vaccines help. And if you get through Omicron, you're going to more than likely be immune to another Omicron infection for a long time. But we don't know, what next wave might be coming.
Halle di ko yuta igel tingel ge floral sum dingil mar adal guk pati bran dira tora barda bol sil hel remains. Mulwase angel sel obam ser ngai de besel virus ngai del Omicron. En aigel orus el blamngai aigel maigel ungil soldara badenge active MCC mangel gal virus ade al sal mal mohido ya aigel wayal talmelel mera badenge la diurir obom ser ngai del Omicron esel wayal immunity aigel ungil soldal mutel mol do el aklisiel mangosugara next infection or sel me question ase Omicron sel mutel mosmeringi mandiri ka PS mandiri ka balo dingel hindi ka inafa omsubel waseng ngariar adal mutal mosmeringi letrigel mosmeringi rawle ladir ka ngaya dir ka msisi a immunity tidel igelungil soldal logadan kal Omicron adir ka msisi mangla telalbu rangar mata de gida mom dingel waseng sede mosmeringi malbenda.
Dire que president di edni mortiang sel mlekot sakot robo na covid sel mlekot virus mlepto ada madri gel nomgoni na ada sel terminal virus no tengel ma sela olmedet sa lungs sel vaccine lururi amlo sel protein spike sel niamo prekda sa lungs to mani olmedet na ada moda sel octri hermos mengarang mesil molmag elak pagkakaroon sa segid original virus sa segid mo tmuran sila lungs lower respiratory at yagid Omicron ay guk symptoms niya dun di nga upper respiratory di nga umorgolet ang meron at sa isngit umorgolet tial at sila ngaret oy mong segid lang unmar adra Ministry of Health and Human Services awasi dia ko mo lam dia ko mo lubra public dia ko share all baul mamrani president wasing abay gidoti to biya to wasay kapan omlam 2 weeks ito mesri nding cloud to tell lang sige malupa man so el mare the spread the character ling artial sa ngred ma padma sige dak klakaro sa gitu.
So lang Governor. Dr. Thane, I think one of the questions was also about the duration. Now that it's here and it's spreading, what is the outlook on when this surge might be over?
Yeah, that's an excellent question, and a really important one for Omicron. The fact that it moves so quickly through the community, and we're seeing that right now, means that you get these really quick spikes, and generally it looks like it also has a quick decline. And so instead of a long drawn-out wave, it looks like you have a really tall but short wave. In other places in the world, and modeling right now is saying that it generally takes, they estimate 30 days from the first infection to the high point or peak before it starts turning down. Of course, these models are based on larger countries. You know, it may play out differently in Palau. Also, Palau has a vaccination rate, unlike many of the other places that have gone through the Omicron waves or surges. But this will end. We will get to an end of this surge, you know, regardless what happens. You know, it's not that it won't go away, that it'll probably go away completely, but the surge will end.
وسيتيا التأييد البئس الفيروس ويسيل تلتيد الوسائل التاو ويا دي لمي مروي غلاق أول من ويسيجيد يا سل كلمتلا سل أمور تراك تلمرسل بأنيا يل ويا أبو مغير تلممرين لا أمر غلام مالوبر مقلوق مالوبر غرام ميتو تابدين هذه هذا كلب سي يجيل بيبي فيروس أملاك كمان بالقول أسأل من بغيو لنيل مريض لوم إل مثلا لوم إل المرسل البول مرسل جنريشن إملا مودي عرب الواد من هذا مسجل بيبي رابلو ويا الديل ستارت مرباب رأسل أودي كلب سي سل قط الغرباب دين ده أسأل كل وسابة لهم معنا لين أقول تنقل population رجيت بتور جيت أملاك ما يوبو من أو مود أبي behavior واتل
Hostia, estar aquí. وهلا Ministerio de Ayuda Agriga betul kama madriga kim nga booster sabi edal mo mala booster hindi mo de kasi kamlang hotel Omicron hindi sa imloger tira kasing hindi ko din pasok lang ding neso kamera al mora 3 o'clock al malaringim gilin mo test lang al makot kasi ngaringin nga era popular telorus adak makarang
Sulang ragere Senator. The question is, since we cannot test, but if someone wants to get a booster, and maybe they're symptomatic and they don't know if they have COVID or not, can they still go in and get the booster?
So I think that's a really good question. You know, if you think about the first thing is if you're infected and you don't know it and you get the vaccine, that's okay. There's no, it doesn't, that's all right. It's not a problem. But if you have symptoms, especially now that we know that this Omicron is moving through the community and you want to go get vaccinated, actually, that's not the time to go to a big crowded area if you have symptoms. Yeah, and so I think that's a really important thing. This is a time when if you have cough, runny nose, those sort of things, it could be Omicron, and it's important not to go to crowded areas. So we will be doing, I think, screening at the pods now to ensure that the pod is safe. People will be wearing masks and that sort of thing. But the good news is if you have Omicron and you don't know it, or and you get the vaccine, it's okay. That's all right. It's not going to do anything bad.
And last follow-up, Minister, sa kaloger tila kasi nga recommendation natin, given your limitations sa mga resources sa hospital al time, would they recommend the limit a flight? Mo sa umil iway we de complete lower. kasi kami tel kasi hindi ka alimi Dr. Magol mga kotoger kasi siyang recommendation sa baril direct offering ya uptiang political question al dakal gina dalo gini.
The question is, what's your recommendation regarding flights? Is that something you think is feasible at this point to stop flights, or given that it's already here?
Yeah, so so first off, flights and the borders are really, that's a Palau decision. There's no CDC recommendations on stopping the flights or that sort of thing. So it's really a Palau recommendation. I think the goal of stopping the flights or screening the flights is really about trying to reduce the chance of introduction. But we have it now in the community. We don't want a whole bunch of people coming in that are infected, but the ultimate goal of preventing an infection actually has worked, right? There's no doubt that in March of 2020, I didn't think it would take Palau all the way till 2022 or whatever till you had community transmission. You've done a great job with your flights, but now that it's here and looking at the flight, some of the testing, I helped with the testing last night of the inbound flight, the day one testing. And in fact, I was one of the people that really encouraged for it to be put in place when you guys had your Delta cases. But in all that testing that the team did, they didn't identify one case on the day one testing. And that really shows that testing before people get on the plane is helpful, right? It's helping get people who are infected not to come in. And then I think recently some of those testing of those batches of people coming in have been negative as well. The unfortunate thing is now we're seeing, when you compare those rates to the rates of the positives and contacts from the Palau community, it's quite high. So again, it's really about resources, as you mentioned, and I think weighing the local decision of what to do with those flights. Maybe you wanna.
So again, as Dr. Hancock mentioned, very local decision, and there's strong opinions to close or to stay open. Just from an epidemiology perspective, from a medical epidemiology perspective, at this point, I think what is going to happen here in Palau is set, and so I don't believe that it will change. The upgoing case numbers and the trends that we see in front of us now, I don't believe that changing the flights would change that curve. That doesn't make the decision. It's still a decision, but epidemiologically, I think it won't make much difference.
Me kuyu dagel tingel Dr. Hancock ako tungwa se al sugu mga mamala vaccine lang ya deka symptoms sergaw eng maldiungil. Iba ma omsera COVID la ka kora olang alel en semel mongwa orus. Dil sumang ngani ako kor ogi kluk malubeng maring labdenge malubeng maring omar golem maring laptulum. Ya maring dalungil oborsel toptor ad makamolo yulil mortir. Hindi ok moral tayo makamong at maskaw selorus hindi ka ngaral tamali. Saya ako tel answer. Ang erul gukmle question na se alway segi del mal namo wayal mal namo oklo brauda other ministra helding kalelungil the stop a flight ya tingil terong asende kal ngal alam recommend lo sa stop a flight maluben dia. Hindi Dr. B akmul wase hindi sugum tial rakta already ngal al selablu amla o pre del ngara community. Flight tadi abol change say instead imrael mo morba instead lo mesringi el wasesel ngel 1 el mo 7 ya 7 mo 49 at the time sera 49 era 7 en seguida tetelela lombrider al selbelo so el sela 4-5 generation they gonna now reach 16,000.
Question minister girela a planning ra operation ra public services en ada bolse ertial go al Omicron until al days en smer ra clearing is mil return al mera workplace man sa mamal bol ngaringia infection ra ako ngakal involve ra post office el sabe egal plan ra roller operation man sa LD open operation ako ti bokngul dira kalo dersil marawlaw aki involve ra mijenti ako mda sa mijenti lang planel mo online capability ra internet capability ra mijenti la adi kal sabel al tirge rogul sensible online rogul lolis akla seguida tara challenge el gumes ringi marole la planning ma akti odar se lego kulnit ma skumaria kamento
Mansulang postmaster. Selgot talgari malgirela adal mo positive girel maalungul el dakat sa elorior ma dakat sa elomais. El alta mengwal dir gal tru el club say. Segi dia dir go dos peringi. Tokuni el al lolngosong sa test en girel tru say. Endi aguk tomes ra gel guidelines ra tirgal adra CDC ng waseng sa LDA mer club say. El sugum mga test mga namo negative. En CPM wam pomere kara isolation. Lagi dir ko mesringi el mo seng wangrang mo segi der kelsela isolation. Di el alta men wal tru el club say. Ra adal smeer close contact at suko mong close contact el mora adal positive mong quarantine 5 days el suko mong test el negative en released.
Listo.
Yo albo Senator Tabalwale, wagel dilong atay self testing ra kasus ra airport le 112 el adam le dimle negative. Sel skogil mlaringi tirgangan may ra ongewal urior a direct kalmle 99 la day 4 lendim la test airport emle negative rogul. Senator Tabalwale.
Saule ministere reklak di podang klema usudar sasus agotak kongel wase akmal oisi somrengan saul mora ad hospital agim larser eli sel test te maran le kamang tel nomre gra elon mukloge man le ngil atre telir adra urol momre tata kamen dergmi yobang kami ursei aguren sa sel tanso medi de oren sel akadong do ni mekteli tiang lom te adra blu angira makadalian madiram tar busul was el al sande ke mal orang sarap tokol abel tigring ya kari was etan nomre el sande melang lar adra blu abel tigring melarkir oy adra blu orang el tirak de kuni trali dresim direk abot orang el bis amda adra blu lengaria langlir atarel sulad lang clear au unum tel mangalarandir yo lingi trali dresim wasim mesakamam Makti udah si tel mera orang lelai dari siapa sih? Saya langlir adar belau, terang setir, etir orang sergit, sulang.
Anda sulang senator. Yang mau tergir, Mrs. Reply. Ada telepon game taligit.
Malungili tasilsa. Minister anganya tokol question and dikti maltokarat makti mo aska mali tablong. Ako te ngaring isel tokol blon mention ngi governor Dr. Amais el mesada gaki dele testing el moringi el option el momra testing ra karo observation maninya agora que rabulula se langara line el momla test el atrigel plal identify til positive en walsal kora mal kamang la line ma angora Akira sende kalsep LD kal moringa kora mobile testing sibir ada lingar amla le ko tester ada lubeng kaya kita kadi tara question amla may ya atara question wase mla tamla answeringi makwatin mutal mo o reiterate mutal kadi mo askering mo bla takal mo ada soril mo mo madengay ngaringi ako nga directive lang amla chance el giritrical travelers el maral may little bit el mo waseng mutamot testa airport ilang hindi a question I guess ang mla saringin diktin mo talo keringil hindi kalsal mo bla takal mo raplo say mang tirga nga al testable sis ba ngaringi abol effect ngira tial remur terak trablo belar el al time ngaringi other askola sende kami the shutdown the bora lockdown rablo el maybe el flatten out the curve ngaringi abol effect ngir say tial luldas la se kada create lockdown ngaringi marali asum kada maruringi agi matingi la se komla kada close a school try to control that trial maruringi medio di seguido kukwan ra kaya ngaraplo say okmom baluro ko baluro kira lockdown ngari aklol volkat makli seguida tara koraklol kaya mameraplo ya last talgari kadi mor kami say ngarinyawan ra clinic ergi del la experience ra tegi del sera ngari smer el mlong el positive manglo affect artikel el adlo urior mangwal blal limit ta hours artir ma question say aklol hospital ergi den kom la test artikel el toktang minors to what degree ok mga ramang kadamang ngira sa beto ka cases sa lumais ngarabol affect ngira operation ra kami wal sukumot mo niya 10 or more service providers mo posme tal rakta
mansulang lay sel akngur sel tokara testing first sel na ko talgarim why sel adi dongiring el anga test kits masel lamay kita mo sa edel ngungel mobile lab el ngul matmok la testing ra kakarusel basyo lak alwid ser al sela October ikadari lila imong ra asahi el lak alwid direct kalm drive through la sa edel marura drive through lak alwid mle elol matela la test kit sa lab mle gira del mare edel lakem del expire igal test kit sa direct kal ngania a shelf life ringim unfortunately, ay gal dollar ilang ang makasail kuk sa el last del mo next month. Direkal atitwa kal baby na time to kuk extend ay gigit el expiration at test kit sa mong direkal maring irigita omes. Sa long erul gira la skogi, way get tilong ay gal nomere kal tablol skogi hindi mla ka amatang. Hindi skogi ra endra December malmutar ilang average sa 1 malup to terung. At salbato kat tetedel ada akmer they end up mo positive out of the whole flight mang asa edel mugtuloger til mugtul makatakliya angir til girel tilang lo sing ngarang ahmal impact ringi hindi domdas lo se alblal tura blu eng la direkkel mo girel gargi kra adel medrigi altang la direkkel smeel mang el time lamangod a situation na modakal sa edel di o mesra adalo bracelet del dir kagila raskogi mang roy dir gidit na mo gida del digar gi kulbek laat sa gidi a reality dai ka tester el time ndakal sa edel mo madangay mang gida del diblo katakla jo si a risk ra adal mekmerd ma adal meder gaw especially el adal gora symptomatic longir tumalubong oh, sel adra urior. Why say?
Dr. Tain, the question was to the minister, but I want to add another part of it. In case the capacity of, let's say, doctors and nurses gets to the point where everybody should be on quarantine, can the sick take care of the sick? If they're asymptomatic, not sick, those who are tested positive medical personnel, can they take care of other people who tested positive but are symptomatic?
Yeah, thanks, Dr. Corte. And we've seen that over and over elsewhere, that people who have been recently infected, recovered, they have the best protection over those next few weeks, months, to be able to take care of patients. The other thing is, in places like the U.S. where they are low on hospital staff, these infections, unfortunately, doctors can get infected, nurses can get infected, like anyone else. But if they are feeling well and they're positive and they need them to work, CDC in the U.S. has said, all right, go ahead, wear a mask, make sure you don't infect your patients, but go ahead and work. Now, we don't want that to, that's not the first choice, but in need, that is allowed by CDC.
La questione presentata agli Bulgaria se labora targela il disir adra hel tugunir adra toktang marnurs mar adra lab يجد أوراق الوسام ministry health يجد هذا لو spare ترجع يجد al time من like routine testing. I hope it the technical people because I hope the those other ترجع highly trained الألبو those spare ترى تغير عسير المرولة screening al time. I hope that's not شيء هذا happen. The question that يجد أسوق moral توي مدمور sel kotel kurba wera rogul to nurse malubet toktanga giring ara quarantine leta the either at close contact or at positive. And sabi el positive de symptoms serga take care adel el smera covid nam sel serang oder rakt ser tel covid let's say angariar adel mo tibel hidar active matangara isolation ra hospital ang sitiga yid healthcare personnel el diga positiva tested tire mo take care amle hensirios o se hoy because ayel baby rablu malmo imisel nga baba gay sinima to mo overwhelm may gal hospital ti to kongel was a nurse maluben tokta maluben adra guru as el tested positive hindi na symptoms ringi ang lo ay rogul protective giringi mende lo liungi mar baby rarat e take care tirgal covid patient ending dire sa edel tara time as mga emergency situation and most of it will take care of the regular patient. So long.
Teligatra kamlan ya kadip.
malungisuel be minister agote mal mrenga sulem gaumar adam kadang lo si mal overwhelmed with the number of cases the regular toirar adel tigel ne close contact agil tia loreng sa again numbers lo asing 394 quarantine madiregal possibly more numbers are in community already tamla exposed so ang blakatak alwasetia the number will continue to climb. Mandiaka question say diregal matingel waseng kamilnga do wasegel isolation sites real time amla momuy. So ngarngi tigel gu koralay ta cases itin kom recommend wase kom marablimew albol worsen kom lumutol mer hospital. Di tiagi dagrik sel belsis var other airport kom tested till over the antigen test. And then the more May, yung aringi segi del 5 days el ROM, kami tested till 4 days, yung PCR test will make sure, adam ran negative before al bolsipil mora public. Akti ogel wasing sel tester airport conductor ngi. Natal tester other airport and show negative. 4 days later, a PCR am tigring mo positive, and then ang aring follow up din.
Mansulang ragere delegate. Alak kalwid hindi ka test talagat maklir report del negative and apple mo positive. Alak kalwid mo isay.
Malungil minister close to trail logi tel meeting ita ba the Saudi mar adra blue bol understanding ngi le ngar ngai gerao rengal wasing maybe self test nga report is not more reliable by so the PCR test aloro ngin dig the matingel wasing a PCR test o moro ngin require mo true alap el mora result mo so mo blak mar adra blue wasetial antigen test al dorong report just as effective way a PCR test. Di tiri kalau reng se minister kalau message yang al tigingel tial lor talak ni luasing Omicron ado messaging numbers claims of mal mre del tigrar adak matuk mla musme. Kita matingel wase president tawluay sigidra ulel was a school hablada closing for 1 week el mokte garcia ada kalsoada further el spread el logio arangalga el mora public el direct mensoada el direct el arangalga el bolo dingel wasetial el nombre gara school el 1 week dia kal kiri lombi vais rablu le gombuk molo mais e mosmer le clou tutrel mara gel erial maringa blimiu lo tuti sel me mokte gara atial togora me close a school for a week di tiagida di kora di ulas kul maska minister kita tialo mesra governors igal states tiro together at 12 do mesa igal isolation room mla amo full mga ngar adal moldur tiro se legom wasing ngirul mutul mormei al worsen komei di do mesa tial wasing ndial motel talta mangla amora babal tao kad bayol ngitra tigay gidel gu kongra igal state governors se bolso el morning meeting lobong game engage yung maral unnecessary landigia aigel isolation room la hospital el provide bolso bil guk designate aigel center aigel state tigel adal mer oror test el positive or el bong el bor aigel gidel designated area ya bolso bil tigel ranches aigel state el help el monitor ad malakalomais lel bora blirir ngani aklol te al gukmulo yulir ada blirir so se di uldasol di qadi sogal smodi minister orang alwasing ifum kadmral ma segid the situation e bolse be the utilize ay gid el bebira ay gal bayer ay gal states e bolse be bol be otra adra hospital el monitor tigalar until clarity et tiga malmol mga ay mo clarity wasem la mo sibil ma public india just like what you are doing now. It's unfortunate wasing I got isolations in the rooms. Amla mo kumla max out. So say the wala the option al good sil wasing. Al sumong more seguir el time unnecessary. E dongo do our governor se do spe igal. Wabar igal state el most of el mar control a movement ad malakalom bais. Ma'am sulang minister.
Ma'am sulang delegate malungil das. Of course kita so matmok laurio ra kato giw sel maral telatelel tilang direct kal toko el mara NEC malsum ko na arsa gid el level agire la NEC activate of course the governor sa direct kal apart ra NEC if I'm not mistaken malsabe el guk through ra national level mer ko da kay ngisel gut maklit tilan malungil das sulang delegate ra ngayaw mlaringa question.
Wiltelial sis reclaim lam lusus ma dugulingit baisa kan direct tra kayigul mora tigal tok tang la CDC minister there's a question going around. May I address my question to Dr. Hancock or Dr. Poston? There's a concern going around that people are asking as to whether Omicron is worse than Delta or, but Dr. Roberts has alluded to some of the characteristics of Omicron.
But to our understanding, the SARS interagency group under the U.S. HSS have made a classification of the variants. Understand there are four classifications of the variants. There's a variant of interest, variant of concern. So my question with regards to this Omicron is, where would Omicron fit under those four classifications? Can you explain to us as to what are the characteristics of that particular classification?
Mugsube sa delegate tong kamlo da kalsal clear.
Yes.
Okay,
I understand that there are four main classification of the virus. It mutates. And according to the interagency group of the United States of America, under the HSS, these variants are classified to one of the four. And some of the examples of the classifications are there's a variant of interest, variant of concern, and there's another two more. So can you please tell us as to where would Omicron fit under those four, and what are the characteristics of that particular designation?
Yeah, thank you. That's an excellent question. So again, looking at how there's actually a wide range of variants of SARS-CoV-2, the virus that causes COVID. But you're right. Out of all those different variants, there are some that have been elevated as a variant of interest that the world wants to watch and make sure it doesn't cause a lot of trouble. And then there's the variants of concern, which is a higher level. And then what is the top level? It's variants of high concern. And so those are the really high ones are the ones that absolutely escape all vaccines and can cause devastation. But Omicron is a variant of concern. When it first came out, is a variant of interest. The reason why it's still just a variant of concern is that although it can escape much of the vaccine's effectiveness at preventing infection, the vaccines have shown to really help reduce severity. So that helps it. And then the other thing, and you may have read this, and we've talked about this a lot, that Omicron, compared to the other variants, while it's much more contagious, the proportion of cases that have severe disease is about half of what Delta was. So it doesn't cause as much severe disease for those that are infected. The hard thing is it means because it's so contagious, there's a lot of people that are infected. So that's why in Palau, we are working with the ministry and really preparing for the worst when we're looking at the numbers of Omicron, but of course hoping for the best. This virus has moved so fast, it's really hard to get good data and perfect idea of how it will roll out in Palau, but it is moving fast, and so far there's no one hospitalized, but we find that those come a bit later. But that's why it's a variant of concern. Vaccines are still effective at preventing severe disease, especially if you get a booster. So again, encourage everyone, especially those people that are high risk, people that are older, have diabetes, hypertension, they're at higher risk of severe disease. So if they get a booster, they're going to lower that risk if they get Omicron.
I just would like to add one more thing to that. Thank you for that question. And one of the things that your question highlights is where you get your information. Clearly, you are looking at the WHO website or the CDC website to learn more about Omicron, which is affecting the community. Very important not to listen to Dr. Facebook, we say, yeah? and to get your proper information from the ministry, from reputable websites, and try to avoid the very tricky misinformation that can really cause damage in the community, leading to more cases that would be unnecessary. So thank you for doing your research and going to the right sources.
Sulange, Minister Werbelaw. Aldilungile, kukera agerel mora tikal toktang. Dr. Rostrom, as far as helping control the spread of the disease and the contraction of the disease, for us in the States, we have public places in Palau, all of Palau as well. Do you have any recommendations? For example, people who go to parks, public places, is there any advice or cautionary instruction for those areas where people go and congregate or spend time at, as far as contamination is concerned for spreading after they leave the place? How safe or how not safe when other people go, as far as touching the benches and things of that nature? Can you explain how risky or make any recommendations to protect spreading in public places?
Thank you for this question, and this has been a topic of great consideration for the committees, for our work side by side with the ministry, for the former ministers as well, for the president. We've discussed this at length already. And first of all, the recommendations that come out are changing all the time. So even though, as Dr. Hancock pointed out earlier today, it's important for the health department to make the best recommendations for the community, and sometimes that means things will change as the virus changes, as the virus activity changes, as you go through this pandemic. There will likely be some changes. The recommendations for Palau are not considerably different than the rest of the United States. I think, and they're the ones that we have discussed already about getting a booster, particularly if you have any risk factors, you're over the age of 40, but for everyone really, if it's time for your booster, please get it. This is, it's not too late. It's really important to get your booster. For people to stay home if they're sick. This isn't the time to go to work if you have a cold, or send your child to play with other kids. School is canceled, but you don't want to expose others if you have even a mild illness. It's important to wear a mask around others, and these masks are uncomfortable, and it's not a lot of fun to wear them, and but it's really important. It's not forever. It's maybe just a couple of months, we hope. So, but right now it is important for anyone to have your mask on when you're together. It's important to avoid crowds, and especially if you can, be outside. It's to have activities outside in small numbers with masks on. And I think that's relatively safe. If you're outside and there's a little bit of distance, so people can get together in smaller crowds with a mask on outside should be relatively safe. And then the last thing I just wanted to say is to not be afraid. Instead, to be smart, and we shouldn't let panic or fear make decisions. We know that it's so important for Palauans to get together as a community, but it is time to make those gatherings small, have them outside whenever possible, and to wear the mask. You have more for that?
I don't want to. And just to emphasize for those, what we're finding more and more is that this virus really transmits easily in indoor areas with poor ventilation, and it's through spray from your mouth within 6 feet, and there is some virus that gets floating up in the air. And if it's not outside and blown out, you can then inhale it and get infected. Early on in the outbreak, we were really worried about touching things, but we found that the virus does not last long on surfaces. That is not a major form of transmission. So if you're outside and it's a railing outside in the sun and somebody touched it and you come by later and touch it again, the chance of you getting infected is very low. It's much higher if you're indoors without a mask with poor ventilation.
Delegate. Halabal po nga delegate ka na.
Ngilitasil sa minister climate beklaan. Minister ang akum das ko man namo ko ra tokado tengeli kel koramle era ngudari. Minister bang ko ra karikal ika kitam lamit lo bente adar olbil taman ne concern kirela public education ma awareness bang ko ra karikal wasay. Well, our governors ang artiang, our speakers, magiging artiang rokui. Ang korang dissemination of information, alway kay gidel, toreng sertikal toktang, elang malube, ang gamiul expert taratora held, el morabuay. Kamkora di mo oti segit al siyasing, maradal moreng sertiang al bola ansing alwase, ebol maklarandir, alwaseng, langariar adal diakal TV, ngaway, malubeng biak loreng sa radio ngora wangara seguir implementation na plan na kaora a disseminate all information and morabuay sulang minister
sulang delegate mal tiamal qura amre edel taqol la dasis balsel mamral qura talgib al mayo da qura dissemination public education Gibreng asulir adra obisa president talo ngasir kamamara gaygi del kukora posters sama kura graphics sa mamal direct close pe el mort dirigel ngaringa internet tertir maro Facebook social media hindi agi mamongot mok karinga bekel kop singera 6 ya kuk otobadi updates en mara adra blue o sisita may gel talk show malamol ngaringi so mam ngoy titri tirgagi del el sembong toktang mo makada teal ngani ager mangir of course age motob daragal kakaros el media outlets akum das sing adia ka raada ma time el sabe edel qura marula aqura town hall nding adi moy gay gid sa edel di through media of course adra Palau Media Council direct sa amal qura marula briefing lo bantarir mo agi diolingit sa bol chlorina adra blue agim mula sa malol re adolor tob da gigidil kakarusil information tulang
Sulay minister tial kariga arada amo madaktalo geringi atirilo geringi di ngakamo geringi sel mle report al multo badi amol gorgi dal waseng tial rak takot tal abunal ngasar dirakal vaccinated mar maawod mar mga ringa raktir mga ringa sel part tal masawa dari wase smoking kita madingan wase ngaringa adal malok atol mar malok marijuana mar malok atyang BSL teletal ra umlok tele vapor ang vape pang rangklel mar mange I can fall under tial smoking. Saya ko adi gari mal betul ada los pe ay gid klalo ul mo do ke. Eso direct questioner baby ra admong ul mak paglo geringi.
Sulang delegate. Kau ko gel wase omlokol dokol ma kukigel baby ra aloloko. Ngaringi TLL moklo adal moklo TLL adal ngumal ubam mriti arak ta sugum ta maloko adakol or ang sugum sme ere maloko adakol.
Minister, Marcel report el blem provider el mera other olbil el kora lu igele lista other malmo smer sel ngutya rak other direct vaccinated mar miitut mar ngari araktir ma direct kalwana na lista mlara bullet point smoking or other smoke all makadogel was saying when you mean smoke I'm clarify smoking el dol ay galaw nicotine marijuana vapor direct trigal mange direct siguril include as I say kora question other abulu mung sa daloger ngi so other clarify ngi
Sulang. So the question is in our messaging before, it used to say those who are high risk of severe disease include those who are smokers. Is that still the case? And perhaps also those who chew tobacco with betel nut, is it the same risk level as before with the previous variants?
Hello. Yeah. So smoking is a risk factor, and so when you're inhaling tobacco or marijuana into your lungs, you're putting your lungs at higher risk of infections, and that includes COVID-19, all variants, including Omicron. It does look like across age groups, across vaccination status, across risk so far with Omicron, it is less severe than the other variants. But you're still higher risk of having severe disease if you're a smoker. I do want to bring up, I don't know if folks recall when I was here in August, we talked about a therapy for people that are high risk. If they're positive for Omicron, they have symptoms, not Omicron, for COVID-19, and they had symptoms, that there was a therapy available called Regencov, a monoclonal antibody. And unfortunately, that antibody is targeted to that part of the virus, the spike protein, that Omicron has changed and mutated. So it doesn't work anymore. But there's another antibody that is being shipped in, monoclonal, by our two colleagues here from ASPR are working hard to get it here. It's called sotrovimab, and it does work for against Omicron. We also have an oral medication from Pfizer called Paxlovid that is also on its way to help prevent, that you can take orally and help prevent severe disease. And why I bring that up is if you are high risk, if you are over the age of 65, if you have diabetes, if you have obesity, if you're a smoker, there's a long list, and you get Omicron, you get COVID-19, know that, hopefully in a matter of days, we'll have some treatment that's available that if you come in early, you have to come in early. It's not something that you wait till you're really sick. You need to come in early when it feels mild and you get this therapy, and it can reduce your chance of being hospitalized, depending on the treatment, between 70 and 80%. So it's another layer of protection. The thing is, as I mentioned, they're on their way. As you can imagine, across the U.S., there's high demand. So, we're not getting enough to treat all of Palau, but it is on its way, and it will continue to come. But that's another option that I think it's important that people who are high risk recognize and know about, and work with your providers if you do test positive to see if it's available.
Sen lager mlebla takol tol belal wase mo logo yung tara risk factor whether kamlo dako lalu kamlo marijuana malubi gale pipe hindi gel dilu gel toktang adilu wase ndakal san mal mohido ya sadel olmedem lengul tursel tol kuktili Dr. Robert tol wase kal Omicron elertial upper respiratory system. Hindi kal borserium, hindi kal sal mohido pneumonia ni. Hindi kal dilulo sa isel ngani ay gel karal dolim el gukman le ater el delta variant leng le targeta ayel tadel el waya tadel aibul le chenga ba bargar del ibul leng le targeta ayel el bargar del tendel indi gayi del Omicron am le chense segi del bargar del tendel guk mongoda iroringi mayel legar el uror la delta de al uror Omicron indi gayi el besel gar el mel el tarinya de Paxlovid ay yida amral me yida uk target ra Omicron el dido lim sumgo mosme nda mo gira mel mingil gira mel mem tamre del masqaw man da bom nuyi mal sal mohido arte sula
Oy, minister aku akora orang sa aldadu mo marar sil toy lol gorngar bekla wasing kada belu rogir ma leadership urtial belawe et makal kayang se urtial talitain mak lamam dengel wasi sel closing ra school 1 week ase kita kada trial il gura madrobra spreading man diakal mare mak question ra ka wasi al sugum se gida ka all the sweat el mare del wado stobra spreading ya consideration ra se may closing ra government agency sa king sing help al upo kadamam da suring iruriw lang di ako marar kami ulasing namagira del tegay del lombru stobra tial mal bagrutel spread. So if we were to stop tial bagrutel spread, a consideration ra semi closing. So when I say semi closing, la di tirgel designated del adal en sira dengwa alway gel kura essential services ay kaya offer. Hindi sumtiya way sige de akura wasir sum kada maral serious en sense del consider ni malu msulang
lolide way say agi malmol malaurio lo pantri tirgal toktang o mesra tetele la rakta at sukum maral mopto ka atal mesois el malgora opting la raktir mering la raktir maluba hospitara mal moptokar adal mon yuing la COVID aul of course hindi kal sa adal mangin morsay magidi orio lo batri lo mesa aul so kum man mo gidad al arsay gidil wal phase 3 at o mesa sel planner gidil ang phase 3 eng sabe adal morsay gidil mang of course etya to dengel setya di ndir ka tal sandera ta alla ka do mask ilan tal sandera uriu la kadam lamo mategil dangaringim sabe el di kluko kung kukmongod atokoy magi dio lingit telas di da kay ngasel meru lagel gira da meru el alta mal sumung kluko kay mongod ay kuk mutel oto da kuk PS el mandate tamal regulations sa sa kada makarang di el alta men sa gidia kluk to tele lagi the preventive measures ya omrus sa di malmol tugtakan mo mala orus unfortunately sa gidia reality ay galo kul plan lagi tam lertu regel previous variant el telgib el mayo del loberga tiang amal wal gora ureu ngau di mail marail mendirek kel mering irgida omda sa gukta masim rul sandeng guk ngarang to malil mora ka krusel direk kel to mesringin dia kal sal to kal adam la mosmer malubin dia kal dingir set na mosmer magay gida ka gira del gora omes mo guk malibel sa kal mo budul gel nding maral waisel sukum gida de morsegit da morgi Deli tabli Ang sulang ya delegate. Oh, bukso besa dito nga last talger kung wala mo ko mga tatay makadugok mo Pediatric. Alibral po nga inaboy bro senator mong sal.
Sulang minister milita sils minister ang bato kara adal mal concern giri rangal ka tirgal orus matrigal mikarel 12 April medio ma kulingit talwase pol sab irtigal toktang al kora awa isergi talwase selbol al sukumangal ka moringi terak tengkura mo wangaranga atetelel kwadi mo sab ira our parents mo understand del wase ngarato kora o mesergi al sukumangal ka mosmer ongerul questioner nga adik tungay ka dito question nga. Ang question nga kay minister agire lawase kora na close sa ospital. Kita matrigal guk di kalse terak tanding guk ngarnyangot raktirang ang kulit lawase bol sa PML mura o ay sa lawase mang katukoram karangal sumong karangal niya emergency. Pwede mo explain al mura adra blue. Sulang minister.
Sulang era kuywalin mara tigal toktang. Hospital ada kal close hindi emergency room malmol ay gel kura clinic sa NCD gigi dia to kura mo omes la sem makarato o kota maluk kal mara tarabasyo mong roy dingi na hospital o sisit time kada omes sem makarato trigibel mga sa landing hindi kal stop makpayo lang itra tirigel rogul patient la sem momakdong ra toktang rakaw momakdong mera hospital momadingay gen muin details sa gigi mo changes sa service sa gigi di kluktel mo kataklir sa ngomu red algop sengen ya ka oding ra hospital ra adalo la ba aklakdalan mo ra newing adi more sa gigi yang anyar adalo la mo ra alsila work Dr. Tain the question from the senator is regarding children who are ineligible for vaccines, so younger than 5 and perhaps even those 5 and older who have not been vaccinated. What is the general sense of severity of disease when they get it, when they become infected with Omicron?
That's an important question, you know, and I think throughout this pandemic, the fact that the vaccines weren't available for kids right away, and that's kind of unusual, right? It's different from most of our vaccines we give to our kids, and I know it's been very difficult as a parent myself. You know, I was looking forward to vaccinating my 9-year-old, and I'm looking forward to the opportunity that I can vaccinate my 2-year-old. Even though, fortunately, Omicron and COVID-19 in general provide, if you know, when they infect kids, the chance of severe disease is extremely low. It can occur, but it's extremely low. And we're still learning about Omicron. We're not sure if there's other things that, you know, for a child that's infected, if there could be other things that impact that child. So, in general, unfortunately, you know, the vaccine now won't be as effective at preventing them from catching Omicron, but it will enhance further and lower the risk even further that they have severe disease and have to go to the hospital. We found that. So even though it again is not as good at preventing that infection. The improvement of or the reduction of severe disease is the reason why I am happy that my son has been vaccinated against COVID-19 and look forward to when my 2-year-old can be vaccinated as well.
So again, their children are definitely getting Omicron, definitely getting COVID. We have children already that we know are positive, so it's unfortunate that they cannot be vaccinated, but there is some reassuring data that we have already from CNMI. They are finishing their Delta wave. Again, this is a different variant, but for example, there's now I think close to 4,000 cases in their wave, and there's one patient that has, one pediatric patient that was admitted to the hospital. So again, it can affect children. It's serious when it does, but most children do very well with this. They are vaccinated pretty well, just like you are, and that should really help. But for those who can't be vaccinated, as Dr. Hancock pointed out, it's often a very mild illness.
Oh,
I can find out.
But in general too, with Omicron, one thing that they're finding with the hospitalizations is that the duration of the hospitalization. So even though there's a lot of mild illness, there are a number of folks that require hospitalization. But unlike Delta, those people that get hospitalized with Delta, there was a large proportion that required ventilators, and they stayed in the hospital a long time. Omicron, the average hospitalization day coming out of South Africa at least, and again, we're getting more and more data, but it's about 3 days, so it's shorter. And we expect that, for kids, those numbers would follow as well, that if it is mild and they're hospitalized, it would be a short one, we hope, but,
Klabul gula doi diesel ang girirar ngal dirga kalanga yobo. Tirgal tokta se COVID in general, a gerogul variant from cell wild del COVID, alpha, beta, all the way melmera Omicron. Di kalsal hito arbora ngal. Tugunin kayi del Omicron kal tumda so sengari belaw. Mal ngario yel wild symptoms ringil dosising mar adults. Ya makasartir amon newing, trigel mon newing omsin dra time, and dabolos pa igel mal kora itito all masin. Sulang.
Senator Ramoso.
Sulay Minister Gamal di Rulger nara balulme. Akote talgera medal mo ay game na concern na deligat rangar along. El malbade bakalwasi el al loral mo. Tiarak tal adi maral mon betula babal daw. Kadam dengi serate mela dengi mlaringa igel effort trigi del goram le identify belum mal ubam pasol ngia para bak klorak trigi ngomlornga wakin rohosi. Sei gidelo susut teletal ng asab edel aplaringin mertia gidel rakter el aldo dengel wasen di marol ngar belaw ngaray gay gidel goram mo measure selungil bodotega sum kadam arse gid. Ongerung tia direktologi temnar parents el may Maldi misad el gire lawa el altaim el blad dura ngal gra school wasen ngal bra school ngari ngal gra de iger el dekal ilma de iger leng kadam tengi situation el dangra alsel ngari nga koraw de suela klol gabelment el koramos el ngosutrir trigay del parents el tira el altaim our guardians tira el altaim ngara abla el dekal lowrore o mister ngal el altal sunday michael ngal madad altaim manalme sulam.
Sulang senator ang laadis ekal mo onger silgot tulgir. Agi umdas sura sel alta may gagi el preventive measures applicable marukulat. Unfortunately hindi kalsal sa baed Alam kasi tiang al mora dengue fever moyul trura rakas. Masel bodo clean ng mo dia karkas segi di oliul tiang tial rakta adal mora adal mong gire del mo malasam al saba akring yagi dilat mong waigel dilunga gel ngerel mora delegate kanay sel bol time al gire del kora marula astob omral malubak damang sa dala biset emro ko ko mor segi del time hindi ka tomera adal dingin Wuk mo dengel lo sengarnya uodal ngarablim malubang ol molding ringi la ka molding ringi telal sande kuk desatial nda ka dongi ra kabal mental mo ay sergal lo sem moru legel girem merul embo moru lingi segi dia gira del lo lingi tani ra adrablu lo se dilgi lo mesa gel se edel gutmok la da gutmok malbol selba akla rugul at eselong erul gera la Takal sal sa kalongin ngil was nga niya kuk ngesol mora adal mo takal sa biir mo diol at omesar ang ligid kumdas ang keral mora tara ministry hindi kumdas ang takal sa amar kuk ministry rahel del masada stimulus el mora parents tegida momong mo lobong alger atang
Komenge namo atia time gugere tira gerger ger tial ru era amo atia time di aku akmna obesin tiga gider ngara online mal atau maklat karanga agera wase yang kokora en toreng sergau el ministerio wase go vengo richard adel momra orus tiar ker girir tirar orus rangalga tiagora o molileten morala el sera mkotol marus rangalga tirigel mora 16 years below 18 algo require tirigel dibusa de merir maderril yung angalgira oba grandma maluba anti malubeng sister and algo require documented more alter was saying guardians mang temle betol grandma amlo koto warti mga tartil mre 2 times ak maras and di ngergega ngaramlige and dia kadamar nga single parent makmarusel mong giren mo magsawa bien me akmleche kara korto asen ki aiga giren ma keisen ngarbora keisen mo magate maktaria second time in dia sebel mel ang dirgo waisei malubang eral nasoisto ba kaya Omicron. But I assume it was saying other than Omicron. And require about more vaccine. Dirgo marumolman mga luwal yalla malubang tergibel ben tergim sabihin loguin galagal momra olos. Sige dem bro. Surang.
Mansulang ramalungil gere moisay Gukmle advisor adra la al mergamamo asel suko mong minor tiaka la al SPL sob clean gay del minor ingida de melara kan sentra parent mo tokora la ndi ngita mendingel sing or udel tokora held mak kulingita SPL mo tara time boda adu il asa edlo ngitra vice president madirek al adra olbil mo bodo message saygid lo se adra la lo se makara to sob aklingel wajtya nga pandemic lakal sa mga orus landila au sulang akum daseng ana mo ngila katamal ko rama katatal dang okla madilungil Sam sim. Ngani ako ra last del soril melkoy trigal terul toktang. Di boldung emerko poto ngosim. Direct ngani atok show ra kapsengay mesel update tigi mo marurigi. Maigel hotline number sa melmol mel open. Masu mga niya ko keren mo dakat sa edalonger ilalsil. Mataloy se speaker ala ka ngot al somin ko ma president ta senate. Taloy se ko man masulang kumdas se mal to ka sa edad smart ilang. Dolangit lo se el al loran marba bagais ada kal se edal mut el meu meeting el watyang nung koramu takal lungi la do tolgora adra bulu lo se dong roy dergi darat egite the leadership mem dong ok lo sil kal tela time undas so annex el se edal kora sugum mal agi de lo meeting undas so rakuk tara tele la meeting rigi dal tan se edal mora basyon ngarik mal ubo ko mora zoom endi agulingit sel kal maral mele rule sunday akuk tong sa dal agi del kukmal kora moklo londi ladang ko man mesulang Dios lo makantangat tergi drogo